Nurse interview red flags. My dog wants to join us. Bro, get down. Red flags in nursing interviews. So if you're in an interview and they don't care what you have to say, they just want to make sure you have a pulse, that would be concerning. Another, there's a reason that they're short. If the hospital can't keep nurses on that unit, why did they leave? Why can't you keep staff? That's a big red flag. Another red flag would be, we are a family. We're a family atmosphere. That's code for, we will exploit your sense of duty and cross boundaries to meet our needs. I got a family. I don't need work to be my family. I need work to be work. And so that's one of my red flags. Another one, I would ask what a normal ratio is on the unit. So like if it's a med surg unit, how many patients do it? What's the ideal matrix? So is it like, all right, our matrix says, 1 to 4, but we typically run 1 to 7. ICU. Okay, yeah, it's usually 1 nurse for every 2 patients, but typically, each nurse has 3 patients and a step down patient. You want to know, what's the matrix say? Like what is it supposed to be, and what does it realistically run? If they're not taking notes or writing down answers, the interviews, they usually interview a lot of candidates and need to take notes. If they don't care what you have to say, if they're not writing it down. I would ask, what's the longest people on the unit have been here? The person who's been here the longest, how long have they been here? How many people have been here a long time? I would say if you have multiple people in a unit that have been there for over 8-10 years, wow, that's wonderful. That was a green flag for me when I interviewed. There was, 7 or 8 people that have been there over 10 years. That's a place people want to stay. Now, if they say, oh, the longest someone has been on this unit is 2 years, that's a red flag. I would also ask how often you have to float, and what units you float to. It's a helpful thing to know about staffing. And I would ask about overtime and if there has been any recent mandatory overtime.